volumes during this time. Tony, thank you so much for joining us.
Thanks, Amanda. Great to be here.
Yeah. So, Tony, you're working in the thick of COVID-19. Can you tell us a little bit about what is happening in urgent care and how we're handling the volumes of people that are coming in?
You bet. Actually, I wish we were in the thick of it, or I wish I could say we're in the thick of it, but we're not. We're actually at the very beginning when it comes to the clinical part of this COVID-19 season, I'd call it. And so we're just barely starting to see patients that are positive for COVID-19. And we actually haven't been as busy as we usually are at this time of year. Normally at this time of year, we're really busy because it's still part of the flu season, but flu is on its way down right now, which is a blessing, which is good. But we're just starting to see those first patients come in with COVID-19, and even some that are, having oxygen problems, that sort of thing. And that's kind of what we expect in the next 2 to 3 weeks, is a large uptick in those patients with cough and fever and, unfortunately, shortness of breath.
Yeah, and then at that point, you guys will be having a little bit more of a busy atmosphere in the hospitals then. So if people are feeling sick and think that they have COVID-19, should they immediately be coming to a facility, or what's the process of how they should seek treatment?
Yeah, so if you have the correct symptoms or suspect COVID-19, it's not necessarily something that you need to acutely be tested for and know that you have COVID-19. Remember, we don't have a lot in the way of treatment. And also, because we don't have immunity, right, in our community yet, when you go in like you normally would with a respiratory illness, you're exposing others, if you have COVID-19, to the virus, which we don't want to do. So when you have those symptoms, the main thing is to shelter in place, isolate yourself. The best thing to do is call the COVID hotline, which is on our website at Intermountain or at the Utah Department of Health. You can find it. And that way, a nurse can screen you for the symptoms that you're having and decide on whether you need a test. At that point, they can actually send an order in to one of our testing sites so that you can drive up and be tested. And you might be told to be tested the next day. You don't necessarily need to go in that day to be seen. Where you would want to be seen is if you're feeling like you need oxygen. There's a difference between I feel short of breath and I feel like I need oxygen. If you have that feeling like I need oxygen, I'm sitting in my chair and I feel like I need oxygen, that's the time to get checked. If it's more acute even than that, then you're gasping, that's the ER or 911. But if feeling short of breath, I think I need some oxygen, but I'm not acutely in distress, that'd be the time that you go into the urgent care. We might see you here in the next week or two. We're setting this up right now, but we might see you even curbside, but have a provider, a doctor or nurse practitioner or a physician assistant see you in your car, so we don't have to expose patients inside the clinic that don't have COVID-19.
Yeah, and I think it's really important too for people to understand that if they need medical attention and it's serious, like please go to the ER, please call 911. We don't want to discourage people from coming to the hospitals. If you need medical attention or it's an emergency, you need to come get the care that you obviously need. We're not deterring people from doing that.
Correct. That's exactly. Matter of fact, we want to. The reason why we wanted to flatten the curve is so that we still have that capability of seeing all the things that we normally see. And if we overwhelm the healthcare system with a lot of respiratory illness, we won't have the bandwidth to see the normal things like kidney infections, et cetera, that need to be seen. But so that's why it's important to understand when to come in for respiratory symptoms, and that is when you're having that feel of needing oxygen, that sort of thing. You're feeling a lot sicker than your normal cold.
Yeah, and that brings up another good question, which you kind of touched base on this, but if people are having that shortness of breath issues, should they be going to the ER or the Instacare? Is there a specific place that someone should head to if they feel like they need oxygen?
Yeah, if you feel like you need oxygen acutely and you're really gasping, that's ER or calling 911. If it's general, mild, I feel like I need oxygen when I'm sitting in my chair, that'd be an urgent care, an Instacare or kids care. If it's that I feel short of breath just when I'm going upstairs, I feel okay otherwise, then that's the time to be calling the Health Answers, the COVID hotline, Connect Care.
Yeah. So, how can people with shortness of breath maintain this at home and not need to access care to prevent pneumonia?
Yeah, so you not necessarily will you prevent pneumonia per se. One of the hallmarks of COVID-19 disease is that there are
Mhm.
infiltrates, which we call infiltrates, you might call pneumonia on a chest X-ray. They're showing up on people even with mild disease, and so having pneumonia in this case might mean that you had COVID-19. It's kind of up to us in the medical profession to figure out, is this something where it could be bacterial pneumonia versus COVID-19 pneumonia, that sort of thing. So you're not necessarily going to prevent pneumonia at home. What you're going to watch for mainly is, do I have a pneumonia that requires, oxygen, further therapy? And that's why, if you're feeling like you need oxygen, that's the time to start thinking about getting seen. And how bad that is determines where you're seen.
Yeah. So, what have urgent care has been doing to kind of prepare for this influx and uptick of cases? Right now, we're kind of at this steady peak of what's going on, but like you said, it can get worse and it probably will. So, how are urgent cares preparing for that?
Yeah, there are a couple things we're doing. One is, like I mentioned previous, we are actually planning on ramping up curbside outside the clinic respiratory evaluations. Matter of fact, we might evaluate any problem, even an ankle or injury, outside in
Mhm.
a car. And then we have tents that will be able to see people in for further triage if we can't do it in their car, so that we can manage this disease outside the clinic where we have less exposure rather than bring them inside. We'll also bring on extra caregivers from family medicine, pediatrics, that sort of thing, that will help us with that. We will sort of run it like you see a MASH unit, with a triage nurse and a triage doctor that helps coordinate all of those other providers that might not normally work in the urgent care, so that we can determine who needs to come inside to get an x-ray, that sort of thing. Otherwise,
Mhm.
a more streamlined approach to people, especially with respiratory disease, so we can get them back home and isolated, and they're not exposing everybody in the clinic.
Yeah, and you mentioned those curbside testing. So we currently have a bunch of drive-through testing options available, and we'll leave the link so people can view that afterwards. But Tony, is there anything else you wanted to mention in regards to urgent care and what people need to know about COVID-19?
Yeah, I'm glad you brought up the curbside testing. I think it's important to know you don't need to be tested immediately. Call the COVID hotline and make sure that you get screened so you know whether you need to be tested. They can send in an order and make it much quicker for a patient, so that when they do the curbside, they're not waiting in long lines, and
Mm-hmm.
make it simple for our staff so they don't have to use as much PPE. When they do it that way, we expose our caregivers much less to the COVID-19 disease, and we make it much more efficient. That, and the other thing to remember is, your primary care doctor can help as well through telephone and virtual visits when it comes to respiratory illness. So a lot of this can be managed at home. And matter of fact, that's probably where we wanted to manage this a lot of the time, is away from other people.
Yeah, that's a great point. So everyone, if you have mild to moderate symptoms and you're looking to speak with a healthcare professional, you can call our COVID-19 hotline at 844-442-5224, or you can visit our website at intermountainhealthcare.org. We have an online symptom checker that you can use that will determine what level of care that you should seek. And it also talks about where those testing locations are. Thank you so much, Tony, for joining us. It's great to have a talk with you, and we'll see you guys next time.
Thanks, Amanda.
Bye.
Bye bye.